Hello everyone, I'm Anoushka Sakpal, a third year MBBS student from MGIMS Sevagram. Today we are discussing about something very important. Can we see this pink ribbon over here? What does it signify? It is a universal symbol for breast cancer awareness. Today I am going to be teaching you steps of self-breast examination so as to early detection of cancer and prevent lives. Breast cancer is one of the leading cancers in females. So we need to make sure that we ourselves are well equipped enough to check our own breasts to see for any kind of lumps or any sort of discharge or any nipple inversions so as to early detection of cancer and prevent it from something very terrible. We know that there are two types of cancers, right? Benign and malignant. Malignant ones are the spreading ones, and the first sentinel lymph node to which a breast cancer commonly spreads is the axillary lymph node. So we are going to be checking and seeing the steps for self-breast examination. Primary step, the very first step, is inspection. You are going to open your dress, undress yourself, look into the mirror and check for the size of your breast. Your breast should be equal in size. Both the breasts should be equal in size. थोड़ा सा चलता है, they should be similar if not same. However, if you notice a very large difference between the sizes, it is an alarming sign. Secondly, we need to also check for the shape of the breast. The breast should appear rounded in appearance and it should be pointed outwards. The nipple should be pointed outwards. As we can see in the models here, any sort of derangement in the shape is an indicative of getting yourself a breast examination. Any sort of derangement, any pores, pewdy orange appearance, like in this case, you can appreciate the lumps, you can appreciate some irregularities in the breast. Similarly, in this case, you can appreciate pewdy orange appearance and this huge lump. In this case again, you can appreciate pewdy orange appearance, these irregularities. Even in this case, pewdy orange can be seen. So that is how you are going to be checking for the shape of the breast. Coming to the color of the breast. Your breast normally should be lighter towards on the outer part and darker towards the areolar area and the nipple area. Any derangement or discoloration can be indicative of breast cancer. You should see if it is reddish in appearance or pewdy orange in appearance, and you should get yourself checked if any of such thing is seen. Moving on to nipple examination. Your nipple should always be everted towards the outer side. In this case, a very well inverted nipple can be appreciated. So if you see that your nipple is inverted, you again have to get yourself checked by a professional. Moving ahead to palpation. Now for palpation, we need to first raise your hand. If I am palpating my left breast, I am supposed to raise my left hand above, and with 3 fingers I'm supposed to examine my breast. I'm supposed to palpate my breast. Alright. Now, when are these examinations supposed to be done? They are supposed to be done 3 to 4 days after the last date of your menstrual cycle. Once your menses end, after 3 to 4 days, check for any sort of lumps or any sort of tenderness in the breast. Okay, before menses, you might feel some amount of tenderness, but that is normal. Again, to remove this fact, to remove this confusion, we need to examine ourselves 3 to 4 days after the end of our periods every month, and we need to make this a habit. Alright, let's move on to palpation. How are we going to palpate it? So if I'm palpating my left breast, I'm going to raise my left hand above, and with the 3 fingers of my right hand, I'm going to palpate my breast. How is that going to happen? So firstly, I am going to be performing 3 maneuvers. Alright, the first is going to be circular, second is going to be radial outwards, and third is going to be linear. I'll be demonstrating it in a short while. Alright, And every maneuver, you need to perform every maneuver thrice, once with mild amount of pressure, once with moderate amount of pressure, and once with some sort of forcefulness. However, be sure that you are not exerting a lot of pressure so as to cause any sort of pain. Alright, okay, moving on to circular checking of your breast. So you need to start with the nipple area, hands ऊपर nipple area से शुरू करेंगे, and it is going to be circular. You're going to palpate it in a circular manner. You're going to check for any sort of lumps, and your palpation would be ending in the axilla. Alright, we need to check for any sort of lymphadenopathy in the axilla. So this is going to be first maneuver. Second maneuver is going to be radial. How are we going to do that? Again, 3 fingers, हाथ ऊपर, starting with nipple, radiating outwards. Alright, we are going to be radiating outwards. We are going to be palpating it outwards. And we need to check for any sort of lump, any sort of pain or tenderness. Again, this kind of maneuver will end up in the axilla. Third is the linear maneuver. We have to start this from our breastbone or the sternum, and then we need to palpate up and down in a linear manner or a wedged manner. Alright, again this should be ending in the lymph node, axillary lymph node. So these are the 3 maneuvers which are supposed to be performed. Now, to check for any sort of discharge from the nipple, any sort of discoloration from the nipple, we are going to perform nipple examination too. How are we going to do that? Right away. We need to first stand, hands up, and check for the size of the check for the inversion of the nipple, whether it is inverted or everted. Then we are going to hold the nipple and press it gently to see if there is any sort of discharge. Now this discharge could either be whitish or reddish. It could be milk, it could be some purulent discharge, some non-purulent discharge. Any greenish color of discharge is appreciated too in certain cases. So we need to make sure that we are not having any sort of discharge. If you're a lactating mother and you're lactating, that's fine. But if you're not lactating and you're still getting some sort of milk, that's wrong. And you need to get yourself checked. Again, how are we going to do the nipple examination? Press the nipple gently and check for any sort of discharge. Either you can do it this way or you can rotate it so as to squeeze it and check for any sort of discharge. Discharge could also be seen on bras. You can feel some wetness on your bra, and that's how you can check for discharge. Okay, so self breast examination is a vajra, and this vajra must be used to educate each and every woman, be it in the healthcare profession, be it your family members, be it your relatives, be it your patients. We all must learn and equip ourselves with self breast examination, as it is such an important tool for early detection of breast cancer. I hope you've understood this. Any questions or queries are appreciated in the comments. Thank you so much. Presented by Team Sanjeevani.